Some encouraging news coming out of today's Tri-County Health Press Conference. Officials saying we could leave Tier 3 mitigations as soon as next week. We've been under these extended restrictions since late November. Our Durante Matthews joins us in the studio with when we could start advancing. Durante?
Well, Mark, Friday, January 15th is when health leaders say we might finally be able to move forward and loosen some of these restrictions. Now, although Public Health Administrator Monica Hendrickson says the Tri-County area is starting to see those COVID-19 cases creep up again from the holidays, with the 7-day average increasing by 30 cases in the last week, she says it's not a huge concern at the moment. She says the 7-day average for hospitalizations remains steady, and Region 2 has been below the 12% positivity rate for almost 2 weeks. Hendrickson also says there could be a possibility to skip Tier 2 and go straight back to Tier 1 mitigations, where indoor dining would once again be permitted.
Right now, where we sit does allow us to go back to Tier 2. Our levels of positivity are below that 12% value. Our hospital capacity is well within control. All the great work we've done since November 20th has made an impact.
Now, Hendrickson says they're still waiting to get clarification from the state on if we can skip Tier 2 mitigations for Tier 1. She says they're hoping to get that information within the next few days. Kimberly?
Durante, thank you. Also out of today's press conference, officials say the slight surge in COVID-19 cases is all the more reason why they're focusing on vaccinating as many people as possible. Monica Hendrickson releasing more information about who is eligible for COVID-19 vaccines in the Tier 1A group, which now includes all healthcare workers in the Tri-County area, meaning all staff in hospitals, medical facilities, clinics, pharmacies, home health care, long-term care facilities, health departments, EMS, and other medical personnel. Hendrickson says the goal is to move on to 1B, which includes frontline essential workers, but we may have to wait until the entire state is progressing.